Hello students, here I am with my next video. Today we will be discussing about radius, the features of radius and attachments as well as the clinical anatomy of radius. Okay, I hope you must have watched the previous video about the side determination of radius. So today we will see the gross anatomy of radius along with the attachments. Okay, so this is radius and the introduction of radius. The radius is a lateral bone of forearm region. It lies laterally in the forearm and it is homologous with the tibia, the medial bone of the leg region. Now the question is there, it is the lateral bone and why it is homologous with the medial bone of the leg region. Okay, so the answer is very easy and you must have know the answer. With the evolution, the erect posture of human, what happened to the human beings? The upper limbs get emancipated, means what, they get free, legally free from the weight bearing job. Okay, previously the forelimbs were used for the weight bearing. Okay, so if we assume that, or you consider that the upper limb is using for the weight bearing, then we will put our upper limb like this. Okay, so this thumb will come inside, so this is the pre-axial border. Okay, similarly the lower limb, leg medially, great toe side border is the pre-axial border, but our anatomical position is like palms are facing forwards. Okay, that's why the post-axial border comes medially and pre-axial border goes laterally. Okay, means this is the pronation and this is the supination. Okay, so this is the pre-axial border and this is the post-axial border, and that's why the radius is homologous with the tibia. Okay, get it? Okay, so nowadays what is the role of upper limb? The upper limb is used for the picking, holding, sorting, and for the manipulative skills. Okay, so that is the basic difference. Okay, so upper limb is get free from the weight bearing job. That's why pre-axial border is now became the post-axial border. Okay, that's why this is the as well. I want to tell you that you must know this is the flexor surface. Okay, flexor surface of upper limb, as compared with the lower limb, the anterior surface of lower limb is the extensor, while the anterior surface of whole the upper limb is flexor. It is vice versa. Okay, so that's why this is the basic difference you must know initially, and it is the introductory part and you have to read about it. So I hope you may have clear the things. Now the introduction of radius, it is a lateral bone of forearm region and it is homologous with the tibia of leg region. Okay, and what is the role of radius in our body? So the upper end of radius forms the elbow joint. Okay, it takes part in the formation of elbow joint, as well as the lower end forms the wrist joint. Okay, the upper end forms the elbow joint as well as the lower end forms the wrist joint. Okay, in spite of these two joints, there are another three joints. Which three joints? Superior radial nerve joint, middle radial nerve joint and inferior radial nerve joint. Okay, so the next, the side determination is clear now. Now the gross anatomy, the features of radius. Radius has upper end, shaft and lower end. So upper end of radius has three parts: head, neck and radial tuberosity. Head, neck and radial tuberosity. Okay, so head is disc shaped. It is disc shaped. Okay, it has superior surface. It has superior surface which is concave. See, this is the concave and is covered by hyaline cartilage. Okay, it is covered by hyaline cartilage. It get articulate with the capitulum of the humerus, lower end of humerus, to form the elbow joint. Okay, the circumference of head. The circumference of head is also articular. Okay, and it get articulate with the radial notch of upper end of ulna to form the superior radial ulnar joint. This is the circumference of head, and it get articulate with the radial notch of upper end of ulna to form the superior radial ulnar joint. It is also attached with the annular ligament. Okay, now the neck. The neck is constricted part and the lower margin of neck is attached with the annular ligament. Okay, annular ligament means it is like the arch type ligament. Okay, now the radial and the head and neck both are free within the capsule of the elbow joint. They free and they can move. Okay, so the third part is the radial tuberosity. Radial tuberosity lies just medial to the lower part of the head, and it has smooth anterior part and rough posterior part. Okay, tuberosity you can feel. Okay, this is the tuberosity. It has smooth anterior part and rough posterior part. Now after the upper end, now the shaft. Shaft has three borders and three surfaces. Now as it is the lateral bone of forearm region, it has medial border and lateral surface. Okay, the anterior and posterior borders and surfaces are the same, but the lateral surface it has and medial border. Okay, so the borders are anterior border, posterior border and medial border. Now see, anterior border, it starts from the anterior margin of the radial tuberosity anteriorly. It goes downward obliquely in its upper part, and its lower part it is vertical and crest like and end just anterior to the styloid process. Okay, this is the anterior border. In its upper part it is obliques, and this portion is called as the anterior oblique line. Okay, the posterior border, it is a mirror image of anterior border, means it is similar almost. So it starts from the posterior margin of the radial tuberosity and goes downwards. In its middle part it is crest like and prominent or well defined. Okay, so this portion is called as the posterior oblique line. Now the medial border is the sharpest one. It is the sharpest one. It starts from the radial tuberosity, goes downward and forms the posterior margin of the ulnar notch. See, this is the ulnar notch and this is the medial border. Medial border forms the posterior margin of the ulnar notch. Okay, so the three borders of the shaft are anterior border, posterior border and medial border. So the surface between anterior border and medial border or interosseous border. Interosseous means in between ulna and radius this border comes. That's why it is called as the interosseous border. So the surface between anterior border and medial border, this is the anterior surface. This is the anterior surface. In its upper part it has nutrient foramen and passes the anterior interosseous artery. Okay, now the posterior surface, the surface between posterior border and medial border, this is the posterior surface. Okay, This is the posterior surface, this is the anterior surface, and the surface between anterior and posterior border, this is the lateral surface. Okay, I guess you can observe it clearly. See, the anterior border just medial to the styloid process, the posterior border, okay, posterior margin of the styloid process, and the medial border, it forms the posterior margin of the ulnar notch, and the surface between anterior and posterior, this is the lateral surface. The surface between anterior and medial, this is the anterior surface, and the surface between posterior and medial border, this is the posterior surface. Okay, now the lower end. The lower end of radius has 5 surfaces. It has 5 surfaces. It is expanded to form the styloid process on its lateral part. Okay, the anterior surface, it is in the form of thick prominent ridge where we can palpate the radial artery. Okay, this is the thick prominent ridge. Now the posterior surface, it has 4 grooves on it for the extensor tendons. Okay, and it also has the Lister tubercle. Now the medial surface represents the ulnar notch. It represents the ulnar notch, and the head of ulna get articulate with this ulnar notch to form the inferior radial ulnar joint. We have seen the superior radial ulnar joint here. Now here the inferior radial ulnar joint. Okay, and the medial border in its lower 3/4 gives attachment to the interosseous membrane and forms the interosseous joint. That is the middle radial ulnar joint. Okay, so medial surface of the lower end represents the ulnar notch, and it get articulate with the head of ulna to form the inferior radial ulnar joint. The lateral surface represents the styloid process. Okay, this is the styloid process. And inferior surface, it is the important among all the surfaces because it is divided into lateral triangular and medial quadrangular. See, it is marked lateral triangular and medial quadrangular. So lateral triangular part get articulate with the scaphoid, and medial quadrangular get articulate with the lunate to form the wrist joint. Okay, so see students, it is very important bone. Superiorly it forms the elbow joint, inferiorly it forms the wrist joint. Along with these two, it also forms the superior radial ulnar joint with the circumference of the head articulate with the radial notch of ulnar bone. Inferiorly it forms the inferior radial ulnar joint. The ulnar notch of lower end of radius get articulate with the head of ulna to form the inferior radial ulnar joint, and the medial border in its lower 3/4 has attachment of interosseous membrane, and it forms the interosseous joint or middle radial ulnar joints. In this way, the radius play most important role, the forearm. Okay, so this is all about the radius, the clinical gross anatomy or the bone impressions. Now the attachments of radius. See, the anterior surface has 3 attachments, posterior surface has 2 attachments, and lateral surface has 3 attachments. Okay, so 3, 3 and 2 along with some disc or joints. So it is very simple to remember. On the lateral surface, the superior part receives the insertion of supinator. The middle part receives the insertion of pronator teres, as well as the lower part receives insertion of brachioradialis. So supinator, pronator teres and brachioradialis get inserted into the lateral surface in its upper part, middle part and lower part respectively. Okay, now the radial head of flexor Digitorium superficialis means sublimis muscle. It get originated from the anterior oblique line. Okay, and the flexor pollicis longus. It also originates from its upper 2/3 of the anterior surface. So anterior surface gives origin to the two muscles, flexor digitorium superficialis as well as flexor pollicis longus. Now the lower part of the anterior surface, it receives insertion of pronator quadratus. It receives the insertion of pronator quadratus. Okay, and the posterior surface, abductor pollicis longus, while the extensor pollicis brevis, both get originate from the posterior surface. Okay, so three muscles insert on the lateral surface, two muscles get originated from the anterior surface, and one get inserted into the lower part of the anterior surface, that is the pronator quadratus, and two muscles get originate from the posterior surface, that are the abductor pollicis longus as well as extensor pollicis brevis. Okay, now the margin of the inferior surface of the lower end is as the articulation of capsule of the wrist joint. Okay, it gives attachment to the capsule of the wrist joint. Then the 3/4 of the lower 3/4 of the medial border gives attachment to the interosseous membrane. Okay, then the radial tuberosity posterior rough part, it gives provides insertion to the biceps brachii, and anterior smooth part is covered by the bursa. Okay, so in this way the attachments of radius we have seen. And lastly, the clinical anatomy of radius, again it is very much important part to learn. When a person fall on the outstretched hand, so the 2 centimeter above the styloid process, it get fracture at its lower end, 2 centimeter above the styloid process. So the fracture, if the distal fragment get displaced towards the upward and backward, then it is which fracture? Colles fracture. Okay, which has the Diener Fock deformity. And if the distal fragment get displaced anteriorly, means towards this side, then it is Smith's fracture. Okay, so the Colles fracture is very common in females, and as well as Smith's fracture is also simultaneously we can found in the patients. And the another clinical anatomy, see, it oftenly get observed in the children's when they fall on the outstretched hand, the annular ligament, the grip of annular ligament get loosened, and the head, it is called as the subluxation of head. A powerful jerk or sudden jerk if they have on their outstretched hand, the annular ligament loses grips and the head get loose from the annular ligament. It is called as the subluxation of the head of radius. Okay, so students, keep watching the videos and raise your queries, ask your questions. You can ask in with the comments, and you can ask directly to my WhatsApp number. Okay, so we will make the videos accordingly. Thank you for watching.